sad. Good morning. What a way to start a podcast.
I'll be very, very
I'll
sad.
be so sad. No, Carrie was telling me that she has a meeting at 11 because she has to work because this woman is incredible at doing insurance things. And I said, if we go till 11, I'll be very sad because I don't have that kind of patience to talk about the same thing for that long.
You know what's been just grinding my gears?
Tell me what's grinding your gears.
The last, 2 weeks. Moji.
Oh, yeah.
Like,
yeah, Queen, pop off. Let's hear it. Who am I?
Just the requirements. Like, I always, provide, too much information, I feel like.
Mm-hmm.
But every carrier is like, no, we need, the URL. Like, you could tell it was, a screenshot from their online portal.
Yeah.
And they're like, we need to see that it says Cigna in the URL. And just,
yeah.
Just
yeah.
lots of, that little petty drama with
Petty
Moji
drama.
Eye.
Yes.
I despise Moji Eye.
So,
If you don't live in Missouri, it is a anniversary rule that you can change your supplement, no health questions asked, but you have to provide plan name, company name, member ID, up-to-date banking statement, that it's up to date. I don't even know what else, but
So up until, honestly, 3 years ago, it was Missouri, California California has a birthday rule, which is you get to change like or lesser plan 30 days within your birthday. And then Washington, there are no rules. There is no underwriting. It's the Wild West. It's nuts.
Really?
In the past 3
You can
years,
change a supplement whenever you want.
whatever you want. Yeah, no underwriting. Community rating, it's wild. It's the Wild West. Ooh, I do have an update on that. My compliance officer, Shaylin, who is also just an industry guru, let me know yesterday. I was like, that's going to be wild, but we'll get to that. So in the past 3 years, I think we're up to 28 states have now issued some sort of either birthday rule or anniversary
28
rule.
now?
It's over half. So if you're in a state
When's Kansas going to get that?
Right? Well, and then here's the thing. That's where a lot of people are asking, well, it sounds great. So, Illinois kind of has, quasi one. Louisiana,
What does
Nevada.
Illinois have?
Illinois is, you have to stay within the same company, but you can switch plans.
Plan letters?
Yes, but you
I
have to
didn't know
stay
that.
within the same company, and it's a whole thing.
Does SMS have, a cheat sheet?
We do.
Ones?
Yeah, we have a cheat sheet of every state.
Can I get it?
Yes, you can. It's actually on our university. Go to sms-university.com.
I'm there.
Or
I'm
just
there
click our
today.
training, and it's just called State GI Cheat Sheet in our white papers. So we do have that.
Yeah.
Yeah.
Yep.
Um.
Plan.
Yeah, I like to like plans.
Benefits.
Yeah, with no underwriting. Washington. Yeah, Washington's the Wild West. It'd be nuts out there.
There's so many people I'd like to switch from an F to a
But
G.
here's the problem, right? So again, because in Missouri it's like to like, not like to lesser.
Yep.
Most other states is like to lesser. Here's the problem. Everybody's like, oh, I want these guarantee issue rules. That sounds great. In Missouri, or I'll just say this, 2 things that'll happen. Number 1, you have to work twice as hard to retain your book of business because it's not as sticky. That's one.
Yep.
And 2, it could be, look at Missouri rates compared to Kansas rates.
Oh yeah,
Kansas
they're
rates
higher.
Kansas rates are
For
much
sure.
lower. Missouri rates are much higher because the unhealthy book of business moves more often.
So do they just not have as big of rate increases? I just asked today because I was reaching out to all my Allstate clients who had to tell them about the 20% rate increase. And I was getting ready to call, and I was like, oh, wait, they're in Kansas. And then I was like, wait, do they?
It isn't going to be
the
that high.
20%
No,
rate
there's going to be. Well, no, okay, so we're getting to other things. No, Missouri is always going to be higher. Missouri is always going to be higher. But keep in mind, all Medicare supplements are going to be going through double-digit rate increases. I stabbed you with my nails. I'm sorry. All companies are going to be going through double-digit rate increases if they want to survive. If they want to stay in this market, you're looking at average 15% rate increases. Missouri's always going to be higher. You'll also see in Missouri, and now looking at these other states, same thing's going to happen to where you are going to see kind of what it used to be back in 2010 through 2015 era, where it was come in with a really, really low rate and then jack up the premium the next year. Missouri's kind of always stuck a little bit to that, with the exception of a Transamerica or United Healthcare. But you're going to see those other states start doing that, where a med sup company used to be pretty good in a state for 3-4 years. You're going to see low rates immediately exit. Low rates immediately exit.
Dang.
Hi, Brittany.
So can I know we have a completely different topic today, but I never have like issues with supplement plans. Like, there's not like much communication or like problems that my clients call me about. Customer service issues. It's usually, denials on an Advantage plan or whatever it is. There's just not usually, other than, hey, I got a rate increase letter.
That's should be, as long if they understand how their plan works. Yeah.
But Allstate, I have 3 clients who like have complained on the supplement side, and all 3 of them have Allstate.
What's their complaints on?
One of them got a rate increase twice in a 6-month period. Brittany, you helped me with that one. And then they ended up going back on the second one. And so that just created a lot of issues. Another one was the Allstate was reimbursing their fitness for 6 months that they were on the plan, and then all of a sudden they just stopped. I still don't have an answer for that one.
That's good.
I don't remember what the other one was.
Yeah. Allstate was one that they just got a ton of business that I don't think they were quite ready for. Right. And so they were kind of learning and growing, and unfortunately, in some cases, the consumers felt those growing pains. But I think you're going to continue to see them be a kind of flagship carrier for a lot of, they'll circle back around.
Yeah.
Brittany says, I would love to look at the fitness one. Text Brittany. Okay. Brittany knows everything.
I know she did. I never feel like if I can reach out to her directly, though. I always feel like I have to go through the channels.
No.
I don't know why.
Brittany, text Carrie. Text Carrie. She loves, let her, give her the your digits. You remember that show? I think it was a Mad TV.
Give me
your digits.
Oh, you like Mike and Ike's?
The back of your head's be ridiculous.
I love
I'm so happy. Okay.
Where your boyfriend at?
Where your boyfriend?
Getting you Mike and Ike's? Oh my gosh, I love that so much. Oh.
If you don't know what we're looking at,
so
good. It's not SNL, right?
No,
it's Mad TV.
Was it Mad TV?
I think so, and it's this guy in a movie theater.
I haven't thought about that in so long.
The back of your head is ridiculous. It's ridiculous.
Me and my sister used to love that.
Okay.
Did not submit what they needed to. They give them a discount for a period of time, but eventually... Brittany knows all.
Brittany knows everything. Let's go ahead and dig
into...
What
are we talking about today?
Today, we are talking about, in light of what we talked about last week, I think a lot of our focuses from this point
I've already started my AEP prep, by the way.
There you go. So
it started.
That's what we're talking about from this point going forward, because this AEP is going to be an AEP that I've been doing this. This will be my 12th AEP. I have never seen an AEP like what's coming up. It's going to be complete madness. We're expecting 75% shopping rates. It's going to be great. So a lot of my focus is on how the hell do we get agents ready? How do we get ready for this AEP? One of the biggest ones we're going to talk about today are going to be ANOC events.
Which is perfect, because I said I've never hosted one and I want to do one.
But you're also the queen of events. So if you I would love your insight. I would love your insight on how you do events, how you do this training. And I'll talk to you about I'll talk about the ANOC. You talk about literally everything else.
Okay.
So first of all,
is there non-ANOC stuff on here?
I don't know. And first of all, why? Why are we talking about ANOC meetings in April? It's May, Olivia. Wow, in May. Number one, this AEP, if you're unfamiliar with what I'm talking about, watch last week's episode. But this AEP, due to the Inflation Reduction Act, is going to be bananas. Okay, it's going to be. They're expecting in previous years a 12 to 15% shopping rate. This year, they're expecting 75% of beneficiaries to be shopping benefits. That's going to be because, due to the Inflation Reduction Act, long story short, Medicare Advantage companies are going to have to overcome the cost that is being left on them of the $2,000 maximum out of pocket on drug plans. And so Medicare Advantage plans are going to be cutting benefits, raising premiums. They're going to be getting really creative with how to eat the cost of those drug plans and the Inflation Reduction Act, which means that a ton is going to happen. People are going to be shopping more than ever. And then so what we talk about with ANOC meetings, especially if you have a book of business or if you don't have a book of business and you're really trying to grow your footprint this year, ANOCs are going to be the number one way to do that. Time management, again, if you have a book of business, time management is going to be critical. So fitting in as many appointments, mass appointments,
is what
an ANOC is.
You can bring new clients? That was one of my questions.
Yes. So we'll get into the compliance side of it. But yes, an ANOC meeting, my number one, like I love events. I love seminars. I love presenters because I think it's the best way to build your brand and prospect. It's the only way that I know that actually accomplishes both. Get you appointments tomorrow, but also builds your brand.
Yes.
ANOCs are just a specific type of meeting. Okay. So let's go into what is an ANOC. So an ANOC, for those of you who may not be familiar, an ANOC is an annual notice of change.
So we're just talking about MA plans.
Well, yeah, annual notices of change do come with the prescription drug plans too, but we're focusing here on your Medicare Advantage.
Isn't it called something different too?
I didn't think so. I know you get a quarterly Part D summary where like you get like an evidence of coverage where you get a summary of like the medications you took and the claims and like where you're at in your levels. But I think you do get an ANOC still saying like how your drug plan changes.
Okay.
Somebody correct me on that.
I know they get it. I for some reason was thinking it was called.
It might be
something different.
I always know it as ANOC, but that doesn't mean anything. But what an ANOC is basically your clients will get it it's a letter that your clients receive from their Medicare Advantage plans, and they usually get it towards the end of September. And that lets them know this is the current plan you're on. Here's the changes that are going to happen to that plan come January 1st if you choose to stay on that plan. So that's what an ANOC letter is, an annual notice change letter. What ANOC meetings are basically registered formal sales event. What that means is that it's a CMS approved event. You have to register through a carrier, and it's a presenter audience format, not a kiosk. That's what a formal sales event means. Presenter audience format.
Do the carrier reps ever like want to come?
Carrier reps want to come a lot of the times. Okay. And the thing is we know last year a lot of the carrier reps got X-nayed.
Oh, okay.
And so it's going to be, we'll talk about tips here in a little bit, but like, yeah, get to know your carrier reps now.
Yeah, for sure.
So these events usually happen, these ANOC meetings are great because they are designed to basically go over what you would do in a one-off appointment. You know, this is what your plan looks like this year. Would you like to change? You can do that with an audience of people. So really saves you time, saving you from that one-on-one appointment. Yeah. Especially if somebody doesn't want to change, especially if they're comfortable with those moves, then you don't have to have a one-on-one appointment. You just say, do you want to change? Yes or no? Perfect.
I guess my biggest thing is, though, like so many times during those meetings, they're like, well, what else is out there? Like, how do I know that this is what I want?
Yeah.
And how you can't answer those questions.
So we'll get to that.
Because you can just talk about that plan.
Yeah, we'll get to that. So, but the answer to that is yes. You cannot, if you're doing an ANOC and they're like, okay, but at least the bulk of the appointment being like, what's going to happen to my plan? What will my plan look like this year? That part's cut. You do not have to do that on a one-off basis.
Yeah.
What this does when you do these ANOC meetings, number one, it keeps you in front of them so that people aren't going to answer the phone. They're not going to look for new clients. They're not going to answer the 1-800 number. It promotes you as their agent, helps with retention, helps keep you as like the flagship person who's helping them with their coverage.
So can you say something like, if you're happy with this plan, I would recommend sticking with it. Unless you really need more dental, then let's talk. Let's have a meeting.
100%.
Like you can say something like that.
100%.
Okay, because then you're hinting another plan has better dental.
Yeah, you could.
But you're not like coming right out and saying
the way that I would end the meetings, and it's always about the follow-up is everything. That's why registered sales events are really impertinent, because educational events, you cannot talk about plan-specific stuff, and you can't set follow-up appointments there. You can set follow-up appointments at a registered sales event. So you can say, so the way that I always end it is, thank you guys so much for listening today. If you are happy with your plans, you haven't had any major changes in your health or your medication, and you like your providers, you can stay. You can hang out. You don't have to move. You know what your plan's going to look like. If you're happy with that and satisfied, you're set. Yep. Don't answer the phone, right? You're good.
Yeah.
If you are somebody that you want to explore your options, or maybe you want to see what else is out there, let's go ahead. I have a calendar at the back of the room, or I have a calendar link. Here are my preset appointment times.
I'm so jacked up about this. This is going to save me an enormous amount of time.
Here are my preset appointment times. Go ahead and fill out the appointment, and go ahead and fill out a scope of appointment, because you can accept scope of appointments and permission to contact forms at registered sales events.
This is amazing.
So fill out a scope of appointment, put it in the basket, fill out your slot, and I will call you to confirm that appointment because this is a very important deal. So if you want to have further discussion on it, let's meet one-on-one.
I'm doing this.
So it does. It has the call to action. They know exactly what to do next, and it sets your appointments in a way that you still get control. You get control about when you want the appointment to be. So most of the time, these events happen between October 1st and October 15th because you cannot physically accept applications during that time, but you can start the marketing. So this is going to be your marketing portion of this. And you're not spending time in appointments at this time. So you actually have the time where you can make the most of the first 2 weeks of your AEP. So that's typically when we see these events done. And a reminder, these are to discuss changes going into effect January 1st, 2025 at this point. Michelle asks, what about providers and scripts? I bet formularies changed this year. Michelle, everything is changing.
Yeah.
So one thing, I'll get into that when I get to like the tips, what you can do for that. But my number one tip is get really, really familiar with Medicare Center, aka Integrity for Agents.
I mean, I feel like I would just also say, like, if you've had big provider changes or script changes, get it to me and I'll verify that they're a network.
But here's the thing.
Email.
Here's the thing to say about that.
Resolve that in an email.
Doesn't matter if their medications have changed, the formularies will change.
Right. Like, send it to me.
Yes.
I'll check it. And then, like, I'll email you back.
Yes, exactly.
Like,
so
you're good.
The first 2 weeks of AEP is going to make or break your AEP, right? So ANOCs are a portion of that. The other side of that is making sure they're drug lists, which you can get drug lists as early as right now if you wanted to. Just making sure they're prepared. Something that's really cool, here, I'll talk about it in the tips. Remind me to talk about the new personal agent websites available on Medicare Center that's going to help with the pre-appointment process.
Oh, okay.
It's kind of like Retire Flow. I am still one of Retire Flow's biggest fans. We'll talk about that here more in a second. If someone fills out a scope appointment at an ANOC meeting, do you still have to wait the 48 hours in the sales meeting with them during AEP to begin? We'll get to that in a second. I love that my brain was going to lead you a little history. But I love that you guys are asking questions because it's making me know that like my brain is working the same way yours are. So that's what an ANOC meeting is, okay? The next thing I want to talk about is what does compliance say about ANOC meetings. They're going to be huge this year, but you have to do so compliantly. Number one, you have to register it with the carrier that you're going to be discussing. So if you have a bunch of clients like on an Aetna plan right now, make sure you register it with Aetna. You can't register these events direct to CMS. You have to register any sales event with a carrier.
Can I pause there?
Please.
I've never had a registered sales event. They've all been educational. So what does that process look like?
It's so easy.
Do you reach out to your rep?
You can reach out to us and we'll help you. Most of them do have abilities to go online and they have it through their portals. We can help you through that process to register those events. Like UHCs, you literally just they have like an Excel document that you put the time, the place that you're doing it and upload the list.
That's it? You don't have to like confirm what you're doing or anything?
Most of them are incredibly easy to do. But understand that when you do that, you're opening up yourself to be secret shopped. I mean, don't try to get away with anything because you're going to be secret shopped by the carrier and CMS at some of these events. So don't try to skirt the rules. My recommendation, if you're going to be doing these events, we're going to talk about it with tips. Get to know your carrier reps. Talk to them today and say, my plan of action is to do ANOC meetings. There's a couple reasons for that. Number one, they'll get you the ANOC material as soon as it's available. You'll get it before the clients in some cases. Okay. You can't talk to clients about it, but otherwise you're at the mercy of waiting to know what it is until October 1st. So reps can get it to you earlier.
I think we just got an email this morning about our UHC rep switched.
Yeah. Oh, yeah. So keep that in mind. So get to know your reps. Number two, and keep in mind, the reps are incentivized on retention and growth. So they're going to want to help you with this. They are very invested to help you retain the book of business on that plan. So not only with that, but oftentimes it might look a little, I'm not even going to go there because it will look different this year. In the past, carriers have been able to sponsor the events and actually host them for you. That's going to look different this year because you can't get marketing dollars anymore with the new changes and the new rules. So they won't be able to pay for it this year, but they oftentimes will be able to provide guidance, help you actually give the presentation. Oftentimes the carrier reps will do the presentation on your behalf if you're really uncomfortable with speaking. I don't recommend that. I vote you do it yourself.
Speaking of.
Yeah.
Can you do two?
You absolutely.
With the same carrier? Because I like having, like a lot of my seminars I do for like companies, we have like an 11 o'clock and then a 4 o'clock.
Absolutely.
You know, because not everybody can always make it.
You can do it as many times as you want. You can do multiple carriers in the same day. You just have to register it with that carrier to let them know that you're going to be presenting that plan.
Can I have some like coffee and donuts?
So that's a great question. So that actually goes down to one of my points, which is the $15 rule does apply. So you cannot provide meals, but you can absolutely provide for refreshments. So the way that the $15 rule works when it comes to these types of events is that you can only spend an approximate $15 per head that you expect there.
Yep.
And so there's two ways that it can be done. It can either be done like $15 a person, so like coffee and donuts, that's completely fine. Or if you want to do a giveaway or like a raffle at that event to try to get people to attention to be there, you just have to do, like, if you expect 10 people there, then you can do a $150 prize. But you just have to say, like, why you expected 10 people to be there. So it's an average of $15 per head. You can either do $15 a head or combine that for one prize.
Multiple plans within one carrier in the same ANOC meeting?
Phyllis, you can absolutely do that because you're not registering it with the plan. You're registering with that carrier. But so one of my points on here is that you must go over at least one plan in its entirety because a registered sales event is you doing a formal sales presentation.
Got it.
So like so basically you have to go through the event, the plan, summary of benefits,
start to finish.
Formulary, like the tier level, everything, just like you do in a formal sales presentation. So that's the content that you're going to be going through.
This is so perfect for someone like me.
I'm telling you.
Because like I said, I only have like maybe a quarter of my book of business is MA, but almost all of that quarter is with the same carrier.
So that's something we're going to see a little different this year. But up into the past, we have people who are like 90% MA and they have maybe two different carriers that they work with. So it is really common that like all of your book of business is in one spot or another. This AEP might look a little different. You might see a lot more scattering because the plans are likely to be very varied this year.
But I'm just thinking of how much time I could save with those 30 people. I don't know how many it is.
Stacy, good morning. She says, when can we start having these ANOC meetings? October 1st. Because CMS says you cannot discuss next year's plans until October 1 when AEP marketing begins. So you can have them anytime between now or not. Between October 1st and December 31st, if you really wanted to. Though it really won't do you any good then. But yeah. So October 1st through October 14th is when we see them most done. However, you can have them all through AEP if you wanted to.
I'm doing this.
Some more compliance things.
Wheels are turning big time right now for me.
I love it. Some more compliance things. Two things. One of them being the scope of appointment. The other one is cannot follow an educational event. So what a lot of people do, because educational events, though they do have compliance and associated with CMS, they don't have to be registered. So keep in mind, when you do a formal sales presentation, you cannot advertise it as a Medicare 101. Right? Yeah. So a lot of people, what used to happen was that they would do an educational event when you do a Medicare 101, but you can't take applications, you can't set follow-up appointments, you can't do any of that at an educational event. So they would do an educational event and then immediately follow it with a sales event. You can't do that. So don't do it. Don't do an education and an ANOC meeting in the same day. Just avoid that.
Would there be any rules? Like I could see me doing this and Brandon saying, "Can I invite my clients to your meeting?" So like he would just have to register it too, right?
If he's presenting,
if his clients are there.
How much do you like Brandon? Like, how much work do you want to do for Brandon is the question. Because technically,
I do too much. I do too much.
If you guys wanted to do joint ANOC meetings, then technically only one person needs to register it. But keep in mind, so when it comes to doing these registered sales events, formal especially, you have the ability to set appointments. You can really do whatever you want. You can set appointments. You can take applications. You can pass out your information. You can do anything, right? Well, within like the normal CMS rules. So if he did one with you and you guys joined one, you guys, paid for it together, you guys both had your clients there, he could not take an app that day.
Right.
So because if he took an app that day, he would be in avoidance of the scope of appointment rule because he was not the one who...
I was just trying to think if you did it joint, if there would be no
If you did it joint, no. I mean, like, I would both of you register it.
Just to be safe.
Just to be safe. Okay. Make sure your carrier knows that you guys are doing it together, your carrier rep, because the carrier rep will be like, oh... somebody else is doing it that same day in the same place. Let's try to split you guys up. So, like, obviously, because they try to make it to where everybody can be successful doing this. But there's nothing that says you couldn't do them together. Okay. So now let's get into, so again, at these sales events, if you want to, and people are like, I want to sign up for this plan. Maybe they brought a friend or something like that. They say, I want that plan come January 1st. If it's after October 15th, you can absolutely take applications at that event. Now, the next question. Okay, so Michelle says you can put two events. Perfect. There you go. Awesome. So here's how it comes down to as far as what does the scope of appointment look like. These are considered at any type of formal or informal sales event. Informal is like a kiosk. Formal is presenter audience. So any type of sales event that you do, if you take an app the same day, you still need a scope of appointment. You have to have a scope of appointment. That will never change. Well, that's not going to change with this AEP. However, those are considered walk-ins, which voids the 48-hour rule. However, that's only if you take an application at the time of the meeting. If somebody says, hey, I got to run and grab some groceries, can I come back in a couple hours? You need a scope of appointment. If they say, hey, I love to meet with you, can I meet with you tomorrow? I'm out of time today. I want to sit down and talk with you. Can I meet with you tomorrow? Does not waive the 48 hours. The only time it waives the 48 hours is if you take the application, because then it's considered a walk-in.
Okay. Are you allowed to give out, like, the booklet? Well, no, because they would have already had them. Never mind.
Well, no, you can give out plan information. You can do anything you want to. You can give out. So, like, for example, let's look at an educational event versus a sales event. An educational event, you cannot pass out business cards, cannot collect scope of appointments, cannot collect personal contact. You cannot pass out anything.
Right.
You can make it available, but you cannot pass it out. At a registered sales event, you can pass out anything. You can't make anything required. Like, you can't say, like, you have to sign in, you have to give me your information. You can never ask date of birth in a setting like that. But you can pass out your cards, pass out plan booklets, pass out anything at a registered sales event.
Got it.
Any more questions on compliance? Because I made that in a brief of, like, what are my most commonly asked questions about these types of events? Just know that, like, they follow the same compliance as a registered formal sales event, because that's what they are.
I'm going to have my first one.
Let's go.
I'm going to have my first registered sales event October 2nd.
Second, because the first is scary.
I don't know. I always feel like October 1st is on, like, the weekend.
It has been for the last, like, 4 years. When is October 1st?
Let me take a look-see here. A Tuesday.
Oh, whoa! It's Medicare Cafe. You don't have to do Medicare Cafe.
The first Tuesday.
First Tuesday. I will give you a pass. You do not have to do Medicare Cafe on October 1st. So the last one thing I wanted to talk about is tips. And again, I think, Carrie, you are the person to give tips on just, like, how to do general events. But number one, get on social media, advertise these events, do, like, Facebook Lives about being like, hey guys, I'm going to be at the library on this Saturday at 4 p.m. to cover this topic. Like, just get it out to everybody. It does not have to be just your clients. You tell your clients to bring their friends, their neighbor, their loved one, their dog if they want to. Get everybody there.
Can I tell you something that worries me about that?
Tell me.
That it will look like I'm just representing that carrier if I'm advertising it like that.
I think that's a really great point. The way that I would combat that is by, again, if you're doing a live viewing presentation, being like, in 2024, a lot of, my clients who join a Medicare Advantage plan tend to really like this plan. If you'd like to know how this plan is going to look different this next year, make sure you attend this webinar. Or make sure you attend this presentation.
Okay.
And then in that presentation, you can see, and we can discuss if that plan's still right for you. Okay. Like, you can absolutely lead into, like, we may be switching you, girl, but, like, let's discuss if this plan's still right for you or a good option going forward.
Are we allowed to send anything to our clients now to advise them to look out for their ANOCs this year and tell them generally changes may be coming?
You're wasting your time doing that right now. They don't say
we send it out in September. I send out a newsletter. That's what was making me think, because it said on there, watch for your ANOC. And I remember I had MedSep and PDP clients calling me like, I never got my ANOC letter.
Okay. So that might be.
I remember multiple saying that, and I was like, I have to reword that differently next year.
Yeah. I think so. So kind of how things have changed in the past 5 years. You used to not be able to say the words annual enrollment period until October 1st. they really lightened up on that. If you're educating people, like they're even saying like you can start setting appointments right now for AEP. Like, I mean, they've really lightened up the rules on like addressing what AEP is. The only rule about it is like you can't discuss any plan details about the next year plans until October 1st. That's kind of the major part. You're wasting your time talking about it right now because for consumers, if it doesn't affect me, it doesn't affect me. I have other things going on between now and October 1st. You could be saying starting right now that like you could be like in your presentations or in your marketing being saying like, hey, are you familiar, agent tip, your plan, you need to make sure you review your plan every single year. Set up an appointment with me between, in October to cover what your plan may look like. So you can do things like that. Just understanding that, like, what I advise to say is going to change as we get closer to AEP.
Consider PDP ANOCs. I have a ton on the 0 premium. Me too.
I've gotten a lot of questions about, like, what about my PDP clients? Because the PDP game is looking to change dramatically. Because keep in mind, Medicare Advantage plans.
Could we have a $0 WellCare PDP ANOC meeting?
You absolutely could. But just keep in mind that, like, here's what the PDP market's gonna look like, guys.
But you can't even recommend based on their. I don't feel how you could.
What
do that.
you would be doing on an ANOC meeting for PDPs is basically saying everything is going to change. I don't know that you necessarily need to do a whole meeting about it, but definitely some communication about, like, your PDP plans will look completely different this year. Because keep in mind, guys, Medicare Advantage plans have the ability to eat a lot of the cost, what's going on with the IRA. They'll do so by lowering benefits, raising premium. There's a lot more money hidden in a Medicare Advantage plan that you're not going to see like, you'll see changes. It's not going to be as dramatic. PDP plans are expecting the average premium between $60 and $70 for the average PDP premium going into 2025 because they just don't have the money to eat those costs.
They've got to have a low-cost plan, though. They've got to have a low-cost plan because I have so many clients taking nothing.
Yes, and that's what we're seeing. We're seeing a lot of times carriers are going to be coming up. They're going to simplify those plans, tighten them up, and either offer a value plan where the formulary is trash but the premium is low, or plans that actually do what they're supposed to do, which is cover expensive medications. So you're going to, again, and here's the problem, guys. Carriers are already discussing making PDPs non-commissionable because they cannot afford to pay commissions on it. So if you're wasting a lot of your time working your PDP business, you're going to have a hard time. Like,
it's not like anybody's raking in the money on PDPs now.
No. And again, you can't not do PDPs. And that's off the table because PDPs are the number one retention tool, the number one referral tool, the actual only plan that your clients use month to month that affects their bill folds more than anything else. But they can be really costly and cost you a lot of time and not make you a lot of money. That's why I'm saying, number 3, get familiar with Medicare Center to handle your follow-ups of these events. Medicare Center is going to have a couple really cool tools. Number one, Medicare Center stores the drug list. You push a button, and they're going to be able to, like, just run drug list without you having to calculate it all in one spot. Use Medicare Center to run your drug plans. If you're not, what are you doing? But Medicare Center is also coming up with new ideas and ways to actually handle a lot of the pre-appointment process. I have to blow my nose. Hold on. I'm like,
I was reading the comment here. Mine is 98%. Oh, Phyllis's book of business, 98% PDP and MedSup.
Yeah. So number 1, your MedSup clients may be more enticed than ever to look at Medicare Advantage plans because you're still going to see some $0 Medicare Advantage plans through all of this with their premium doubling, if not tripling on the PDP side, as well as just your Medicare supplement rates having double-digit rate increases. If you thought my clients or MedSup clients are never going to move, think again. You really need to make sure you're talking to your MedSup clients. And I'm not saying jump ship. I think MedSup is still like my go-to product, but you can't sell it off of here's the premium, here's what it covers.
For sure.
You have to sell it as where are you comfortable in risk? How much are you willing to pay to offset the risk? You have to sell insurance again. Yep. That's just the way. It just can't be a price shopping thing because when you only shop on price, that means there is no other value. So you just gotta change your sales approach when it comes to MedSup. It's just a wee bit. with Medicare Advantage or with the PDP side though, because again, your PDP clients are going to see crazy amount of change. Here's what Medicare Center is doing to try to kind of help you alleviate that. They're coming up to where you have the ability to send your client their own profile. So they'll be able to update their own medications, update their own providers, update all their own information.
That's awesome.
And then be able to, if you're comfortable, and then that'll update on your side, you will get notified when they update their own list. Yes. And then you'll be able to either just email them the option, or of course you can always encourage them to sign up, have them sign up themselves through your personal agent website. They can do that. But if they like, no, I want you to tell me, it takes 5 minutes. Get on there, compare the drug list, fill out the application. You can either email it or text it to them. You never have to see your PDP clients.
Will they be able to see, like when we send it to them, will they be able to see their current plan with the one we're recommending? Yes. They'll be able to see all that?
Yes.
That's awesome.
So I made that. Because still across the room, I made it. So just kind of having a big day. I'm going to do that because I just shushed my nose. But yes, I'm kind of having a big day. But yes. So they are, again, another tool is like Retire Flow. Retire Flow.
MedCenter can do that with the application. That
is
easier
huge.
Than Retirement
MedSup does that right now, to where if you have their drug list updated, you can literally just text them or email them the app and they turn it in. You never have to have an appointment. And here's the thing. If you never discuss the plan with them, you don't need a scope of appointment. The only time you need a scope of appointment is if you were actually discussing plan benefits. If you have their updated list of medications and you send them the application saying, this is the plan you need to be on, you don't need a scope.
Interesting.
So again, you can eliminate or like take a couple days. Take a couple days when you're like a crazy coder or a kid living in their basement and just knock out your PDP things, just a couple days of you just living in front of your computer, and then use the rest of your AEP to gain a footprint in the MA space. Because this is going to be the year where people are desperately shopping and you could either lose your clients or make a ton of new ones.
Dang, I'm like ready for it.
Let's get jacked. So again, it's going to be, I will tell you, systems, processes, and technology. That'll be the make or break this AEP.
Like I said, I've already started. Like I've started organizing me and my assistant.
Let's go.
We have.
And here's the thing, guys. What carrier you're going to write is the last thing. You won't know until October 1st.
Yeah, for sure.
That is because, again, we talked about the rebid process of where, we kind of know by end of August, sometimes September, like, oh, this is the carrier we're going to see the most of this year. We will not know that until October 1st because carriers will have up to $140 of a rebid this year. So whatever they gave you and their sneak peeks, plans will look completely different. And we won't know until the last minute.
I imagine a lot of them are just going to dissolve. A lot of the PDPs, I feel like.
I mean, Mutual of Omaha already pulled out of the market. They said, this is not for me. See ya. I don't know that other companies are going to be able to pull out of it because, like, they're going to use those PDP clients as MAPD leads. I mean, like, that's just how WellCare is already doing it. A lot of companies are already doing it. So I don't know the pull out, but it's likely you won't get a commission for it. They can't afford to.
I just don't understand how a carrier can do that. Like, just because the government's paying them more money, they're going to just try to push them that way. Like, it just doesn't seem...
Well, I mean, like, again, I don't want to...
go with the money.
I don't want to get my, tinfoil hat on, but, like, why wouldn't the government be invested in getting everybody on a plan that they manage, that they have a say in, versus Medicare supplements, which is Department of Insurance? Why wouldn't the government want more control in healthcare? It's like they've been doing it for the last 20 years.
For sure.
So I'll take off my tinfoil hat. But yeah, of course there's motivation for the government to try to get people on Medicare Advantage plans.
Yeah.
Do.
Does someone have a good spreadsheet to put plans side by side? I make one every...
She makes one every year. But again, you won't...
county.
Yeah, you won't even...
Yeah, I do that like... Sometimes I feel like I wait until like the 15th.
To do it?
I feel like I start it.
But here's the thing, like I said,
feel like, because isn't it...
In the past, it's been pretty clear cut that, like, my clients are going to want to go on this plan this year, right? There's always been something that, like, yeah, this plan's going to dominate this market. This plan, they call it win the market. I don't know that there'll be any clear winners come AEP because some plans are going to save that money by having zero premium and great benefits, but really crappy healthcare. And others are going to say, hey, we're going to keep the same great benefits, the same everything, but our premium's going to be a little higher. A lot of plans are probably going to get rid of their Part B givebacks because Part B givebacks are the number one. It's a 100% utilization.
Right.
So they're going to get, I mean, like, if a plan's wanting to save money, get rid of the plans that the benefits people actually use. Get rid of the benefits that cost you the most. That's the Part B rebate. So it's going to look, I'll say this. If you need to know your clients on who bought the plans because of the insurance or who bought the plans because of the extra benefits, because you will see a very clear divide this year on what clients are going which way.
Makes sense.
There'll be a lot more variation in the market, more than what we've seen in the last 10 years.
Any text questions?
Oh, probably. I am so sorry for ignoring you. You mentioned ANOCs for MAPD. Don't PDP clients get ANOCs as well? So we did answer that one. Yep. I wasn't ignoring you, and I love you, and I'm sorry.
I just think it's called something different. I feel it. I could be completely wrong.
I thought they were ANOCs, but I don't know. I'll find out.
I don't know.
Terry says, I just love Terry, first of all. Says, I have a plan that already eliminated the what's that word? Help me, podiatrist?
Podiatrist.
Oh, that's a foot doctor. Okay. I went to college. Can I tell people now about that and how also I haven't seen an Anthem rep in for 8 months. Yeah. So no, you cannot. You can, if they got rid of the rep for this year, if they got rid of their podiatrist and they don't have that benefit for 2024, absolutely. But if they're talking about what's going to happen in 2025 and saying we're not going to have this in 2025, no, you cannot talk about that until October 1st.
Interesting.
I know. So I wish Medicare Center had the option to put more than one pharmacy for the comparisons.
What do you mean?
They don't.
They do?
No, they don't. You can only do one pharmacy at a time on Medicare Center. On Medicare
I'm thinking
app.
of Medicare app.
On Medicare app, you can do up to 3 or 6. Yeah, you're gonna have a hard time. Sorry. Medicare app does have the capability to send clients their own profiles, but you don't get alerted. It's not gonna be as fluid.
Okay, so I need to switch gears for Medicare Center.
Medicare Center is the one. I'll say it like this. Medicare app is Connecture's platform. Medicare app, it's there because people love Connecture. Connecture is a solid platform. It's a great platform. People don't want to change, so they have that option. However, all the resources are being invested into Integrity Context, Integrity for Agents, the Medicare Center side.
So will all my drug list in Medicare app transfer to Medicare Center?
I think we found things for your assistant to do.
Gosh.
Yeah, more to come. I love Michelle asked. Michelle Peiser says, I need a template. We'll see what we can get done.
Senior marketing specialists have company sneak peeks like last year.
Michael, that's the problem.
If you have them, you probably won't have
them. So here's the thing. We'll have sneak peeks. We're going to get sneak peeks. I'm doing Devota's rollout in Boston June 1st. We'll have their sneak peeks, what they want to look like. I'll have UHC sneak peeks in July. We'll have their sneak peeks. The problem is their sneak peeks are going to be absolutely worthless because the rebid process of the sneak peeks are this is what we told CMS we wanted to do. That's what they show agents. That's what a sneak peek is. What happens after that is CMS comes in and says, here's the rebid. You either have to take off this many dollars of benefits or you add this many dollars of benefits. In the past, the rebid process has been $3 to $5 per member per month. Now, we're seeing the rebid process being at up to $140. Last year, it was $12. And people were freaking out about what we're going to do with the $12 extra per member per month. Now it's going to be over $100, up to $140.
But if the
plans will look complete. But they have to submit something to CMS, and they have to wait for CMS to come back and say, this is what we're doing. So what they're saying they have a standard deviation rate of $15, anywhere from $30 to $140 or $130. So that really means it could be anywhere from $15 to $145. So they have no idea what these plans are going to come back as. Exactly. So yes, we will have the sneak peek, but they're going to be worthless because we have no idea what the plans will actually look like. All the sneak peeks are going to tell us are where do they want to be competitive? Where are they bringing fire? That's all the sneak peeks are going to tell us this year.
And if there's any what new plans are coming.
Yeah, true. If they're going to file new plans there. Yeah. William, how do you anticipate all of the changes CMS is working on now? Some of the $1,300, will impact AHIP for this year. William, that's a whole other can of worms, but we will see some changes. Primarily, the biggest change we're going to see is what value does your FMO provide? If your current upline, your FMO provides you leads, provides you marketing dollars, provides you extra money per app, they're not going to be able to provide that as we're reading it today. Obviously, we're waiting for the finished comments on that. The $1,300 or 1,300 page ruling came out. There's a 30-page one that's going to follow up with all the clarifications. But, like, what's your FMO providing you? Because if it's money, they're going to provide you nothing now. So that's one of them. Also, carriers won't be able to give you discounts for the AHIP, so expect to pay the full $175 on your AHIP. I do know NABIP is only $100 this year, and every large carrier except for Aetna accepts the NABIP certification, and it includes up to 6 to 8 hours of CE certification in that $100. The only one that doesn't take it is Aetna. But Aetna has their own. You don't have to take the AHIP to do Aetna certifications. They kind of have their own.
That's really
certification. Nice. So you might be looking at the NABIP one this year.
Yeah, for sure.
Other things are going to be how you acquire leads. That's less about the CMS final ruling, more about the FCE. Anyways, the Federal Trade Commission, the FTC. Anyways. About how leads are generated. You can't just go to a mail house and buy leads anymore. So every single lead has to be customized with your name, your title, everything on that. So your leads are either going to get more expensive or you're going to have to learn how to generate your own leads. So keeping that in mind. But lead vendors, the good ones, are kind of finding ways around that. I was talking to Chris Weir of Lead Concepts yesterday, and they're doing seminars on behalf of agents and then giving them the leads from that. So you're going to have to get more creative with your leads. Yeah. That's going to be another major change.
Wow.
Something we didn't even talk about, which I learned yesterday from Chaylin, we don't even have time to talk about it. You got a meeting in 15 minutes. We don't even have time. And I have Medicare. I have a Medicare Quick Start. We have our Medicare Quick Start starting in 15 minutes as well. So something that we didn't even talk about today was the changes to Medicare supplements that no one really knows about. I learned it yesterday about how there is the new rules of anti-discrimination laws are now going after Medicare supplements, meaning that if you're in a state that doesn't offer coverage to people under the age of 65 on a Medicare supplement, you're going to have to start offering Medicare supplements to people under age 65. It also can mean that that everybody will have community rating. You cannot discriminate against age, aka higher premium for being older, or sex, man or woman. Yeah. You can't have different rates for that.
Interesting.
So that we just heard about that. We're just like, what crazy. The hell is happening? So the MedSup game that did pass, and they have until July of this year to fix what's going on and I'm sure actuarials are running crazy. So who knows what's actually going to happen with that. But the MedSup market is also going through some regulation changes.
Dang.
Oh, Michelle, I recycle old leads. Can I still use them? Well, up until plan year of January 1, yes, technically, as long as those leads were developed compliantly. But keep in mind, leads are now considered any lead that is 6 months old, you cannot call. They have to be within 6 months now.
When did that rule go into effect?
Last year. You cannot call a lead older than 6 months unless you have permission to contact.
Dang.
So much. Guys, this is what we're going to be talking about between now and AEP because it is an unprecedented AEP. Like I said, this will be my 12th, and I've never seen an AEP like this before. That William MedSups won't be able to price according to age. Is that correct? That's our initial, or age or gender. That's our initial interpretation of what's going on. Again, I just learned about this yesterday, so I probably shouldn't even bring it up, but it's getting...
So that will keep the MedSup cost down?
No.
No?
It'll get cheaper for people who are 90 and more expensive for people who are 67. Yeah. So it averages out.
Yeah, averages out. Dang. Okay.
It's a lot.
I have to scoot.
I know.
I just cuddled her little leg.
It'll be okay. It's the human contact I didn't know I needed. Sorry, you got a stage fright cleaner now. Speaking of, have you been watching Baby Reindeer?
I don't know what that is.
We don't have time.
I don't know what that
is. It's a show on Netflix about a woman stalking a man, and it is a roller coaster.
Never heard of it.
I'll text you. Any more questions, comments, concerns, as I promised? Carrie's got to go. I got to prep for my webinar starting in 13 minutes. If you are interested in learning more about just this is Medicare Quick Start. It's a 5-day program that Sadie and I do together from SMS University. Every day is a different topic. It's designed to help agents either get into the Medicare market or a refresher. It used to be called New Agent School, but like it's good for agents who are not new too. So that's happening in 30 minutes. I'm fine.
Take a breath.
I'm having a great time. Okay. Appreciate you all. Thank you. Love you. Until next time.
Make
sure I have no text. Until next time, have fun.
Make money.
And give impeccable service.